Today I am going to give a brief note about diabetic kidney disease, that is diabetes and its effect on the kidneys. Hello everyone, I am Dr. R. Saravanan, working as consultant nephrologist in Apollo Specialty Hospitals, Madurai. So, we will commonly see diabetic patients in and around the clinic. So, according to the recent statistics, 1 in 6 patients in India is a diabetic. So, this is a recent data which indicates that diabetic is a very common disease in our country. So what is the effect of diabetic kidney disease on our health? So, the thing is, regarding to the kidney disease, that is chronic kidney disease, diabetes is the most common etiological risk factor. That is a causative factor for development of the kidney disease. So, what is diabetes? The effect of diabetes on the kidney. So uncontrolled diabetes, that is uncontrolled hyperglycemia, will have an effect on the kidney. So it involves the change in the blood flow, it causes change in the blood flow and also changes in the filtration function of the kidneys. So whenever a patient has high blood sugar levels in the initial period of the diabetes and also during the treatment, he doesn't have a good control of diabetes, he may develop diabetic kidney disease. So what is diabetic kidney disease? So in the initial period, patients should evaluate for protein in the urine. So protein leak in the urine. So this protein leak is an indication of early diabetic kidney disease. So we call it as a diabetic nephropathy. So the patient should be evaluated for urine protein. So whenever a patient has got urine protein excretion, so he should be treated for diabetic kidney disease. So when the patient is not getting controlled, or when the patient is not taking treatment for proteinuria in the urine or protein excretion in the urine, he develop chronic kidney disease, which is manifested by elevated urea and creatinine. So eventually he will develop progression of his kidney disease and he may end up in advanced kidney failure or dialysis. So this is the effect of diabetic kidney disease which will eventually lead to kidney failure. So how will we prevent diabetic kidney disease? So whenever the patient is diagnosed as having diabetes, he should always be examined for protein in the urine as well as blood test for urea and creatinine. So when a patient has got type 2 diabetes, which is a common type of diabetes in India, all over the world, he should be, at the time of diagnosis, he should be tested for urine protein as well as blood test for urea and creatinine. So he should be, every 5 years he has to go to a clinic to check for protein as well as high blood urea and creatinine. So this is very essential in monitoring the development of diabetic kidney disease as well as for treatment of diabetic kidney disease. So generally, treatment for diabetic kidney disease includes adequate blood sugar control. So adequate blood sugar control is an essential part, and also treatment for hypertension. So these are the two important measures which is important for prevention of diabetic kidney disease as well as delaying the progression of diabetic kidney disease. So and also patients should take medicines for controlling the kidney disease per se as well as treatment for diabetes and hypertension. And general also, you should be take treatment for general measures for prevention of kidney disease like diet changes and as well as physical activity and other lifestyle modifications. So diabetic kidney disease is the most common risk factor for development of kidney disease and kidney failure in India. So patients should be, the important point is patients should be screened at an early stage for diagnosis of diabetic kidney disease. Whenever the patient is going to visit for checking the blood sugar levels, he should be always checking the urine protein as well as blood urea and creatinine for diagnosis as well as treatment of diabetic kidney disease.